Hi guys, welcome back to Codemaster Coach, your medical coding tutor. Guys, today I want to talk about some medical coding myths that I've heard. You know, we have a basic understanding of medical coding and we tend to have these ideas that medical coding must be. Let's talk about 5 or 6 of them. The first one that I always hear is, isn't medical coding and medical billing the same thing? No. Medical billing is the billing side of healthcare. Medical billers deal with the third-party payers based on the codes that the medical coders have sent or put on a claim. Well, the billers send the claim off to third-party payers and work with the third-party payers on getting the claims paid. Medical coding is just that, assigning the medical codes to the medical diagnoses and procedures, even supplies. So there is a difference between medical coding and medical billing. However, these days I tell my coders, learn them both so that you can do all medical billing, start with the medical coding, and even do the medical billing and deal with the third-party payers. Be able to be that person that can do the whole job. 2, medical coding is just data entry. Oh my goodness, no. Medical coders are able to read a medical record, and based on what the physician documents, they're able to assign codes. If it's the procedure, they assign either the ICD-10 PCS for hospital reimbursement or CPT for the physician reimbursement of the procedures. They assign ICD-10 CM codes for the diagnoses. They assign HCPCS codes for the supplies for the facility. And it depends on what healthcare setting you're in. ICD-10 for cancer or neoplasms, DSM for mental. So there's different classifications for the coding that's done. So again, medical coding is not just data entry. 3, once I pass my CPC exam, I am an expert. You've come a long way with passing that CPC exam, because I always say that was not an easy endeavor. Do we ever become experts? I've been in this profession since 1988, and I am still learning every day. Coding, I don't know if you can ever consider anyone an expert, because things change, if not daily, quarterly, annually. Trying to stay current with everything that's going on in healthcare, that's a full-time job. I can start coding or start my coding career working from home. It's possible. It's possible. I won't say that that's a myth. I'll just say that, especially now with the pandemic, we're sending more and more coders home that not even by choice wanted to go home, but we're sending them home due to the pandemic, which is allowing more and more coding to be done at home. So it is possible to get an entry-level job and work from home. So I'm not going to say that that's a myth. That is true. You can start medical coding from home. 5, I can work from home while taking care of my small children. I'll say good luck with that one. So much research, so much concentration is needed when coding. I won't say no, it's not possible. I'll say as long as you have a schedule that allows you to focus while at work, while you're doing your medical coding, you're able to focus and get done what needs to be done while having small children in the house or the room with you. I'll just say it depends on the individual. And then 6, medical coding starts off making $60,000. I won't knock that either. It depends on your employer. It is possible. But again, I I used to say, okay, you start off as an outpatient coder, then you move up to an inpatient coder as far as moving up salary wise. But I can't even say that anymore because I found that one, providers, physicians, when they find a good coder, they do whatever it takes to keep them, including salaries, upping the salaries to keep their employees. So it depends on where you work as to what salary you get. One time I used to say it depends on the job that you do. That's not always the case anymore. I don't agree with that. I agree. I think that it depends on who you work for and your relationship. Because I'm amazed what employers will do to keep good employees. I'm amazed no matter what setting. Even in a physician's office, you can make as good a salary as an inpatient coder, which because inpatient is considered more in-depth coding, they tend to pay more. But I've seen physician office coding or physician office coders make just as much money as an inpatient coder. So salaries, I just say stay current. AAPC does a salary survey every year. Review those results. Have an idea what to expect when you go in or what to ask for when you go into a job. All right, guys, these are just some myths that came to mind that I was thinking about or based on emails that I received from students asking me, about coding. And I just wanted to come to you with those. If you can think of any, add them in the comments below. Let's keep this conversation about medical coding myths going. And guys, if you haven't yet subscribed, be sure to subscribe to my channel, and I will see you in the next video. Thanks, guys.